There are so many lasers out there, and it's so hard to know exactly what the difference are between them. Now, two of the most common ones that we do here at Contour Clinics are the 1540 fractional non-ablative laser, I know it sounds like a mouthful, and our CO2 ablative fractional resurfacing. If you want to look at it simply, one's more intensive than the other, has a little bit more downtime, which also comes with slightly better results, and one's less invasive, less discomfort, less downtime, but still amazing results. One is ablative, so it actually removes columns of skin cells, and how it does that is that it is specifically attracted to water within the cells. So our skin is made up of about 60% of water, and when this laser energy goes into the skin, what it does is the water selectively absorbs the energy, gets really hot, and then causes it to essentially ablate off, leaving surrounding columns. This is different to non-ablative fractional resurfacing. So if we're doing something like the fractional laser, which I'm sure a lot of you have heard about, or the 1540 non-ablative laser, what you'll find is that it causes this controlled micro damage in columns, but it doesn't ablate the skin off. So that's why you don't get any weeping, oozing, bleeding, nothing, none of that afterwards. But you still get this damage. Now, all lasers work on the principle of damaging the skin in such a way that's really kind of microscopic and controlled, that allows your skin or tells your skin, hey, I need to heal now and stimulate collagen and elastin and all those good things. So here's an example of an ablation there. Okay, so that skin's gone. There's also a hole in the epidermis. So this is the top layer of the skin here. This is the layer that gets sunburned or you exfoliate. You still get that zone of coagulation there, which is the thing, or that micro damage that's causing a lot of intensive collagen stimulation. So this is a 1540 laser there. And you can still see there is that zone there of coagulation. There's a micro damage in the skin. That hasn't kind of caused a hole in the skin, so there's far less downtime with this, but there's still an associated damage that causes an intense collagen stimulation and that result for your skin. To put it more simply, here's a table. The CO2 laser, like we've said, it's ablative. It removes columns of skin, as opposed to non-ablative for the fractional or 1570, 1540 laser. They're pretty much the same. The wavelength is 10,600 as opposed to 1570. The downtime, 7 to 14 days. It all really depends on the settings of the laser. I can give you a CO2 treatment that has 3 days or 1 day or a couple of hours of downtime. They're really gentle. Or I can give you a laser that maybe has 21 days. I mean, I've seen them, if you go more full field, you can get up to 30 days of downtime. Whereas your 1540, non-ablative laser, you got about anywhere from 1 to 5 days of downtime there. Skin removal, yes, you can see back as we saw on those microscopic pictures, you can see there's columns of skin removed with the CO2. There's no columns of skin removed. How that actually manifests, or how you see that as a patient, is that the CO2 will have some oozing of the skin because you have damaged that outer layer, and you may have some crusting, and you may notice on the day a little bit of pinpoint bleeding as well, which is completely normal. You don't get any of that with the 1540 laser. The target concerns, deep wrinkles, acne scars, sun damage, your real intensive kind of skin resurfacing treatments. Or if we really want to kind of turn the clock back a few years and pause aging for a few years, that's what we use. And then your 1540s, we're doing pigmentation, texture, fine lines. These are for people that perhaps might be on a budget, so it's a cheaper form of laser, or they can't invest the downtime to be able to get a proper CO2 laser done, which is really kind of normal given, you know, all of our busy lives. So if you've made it to the end of this video and you want to find out more, please call us for a complimentary consultation with one of our experienced laser clinicians.